లైవ్ ద్వారా చూద్దాం.
Future-proof health systems against those kind of pandemics that you've spoken about from a governance perspective as well?
As I said earlier, governments would have to be focusing on two things. One is preventive care, and the other is curative care. And looking at this from the lens of how to improve this healthcare, one would have to be talking about availability, accessibility of healthcare, and also affordability of healthcare. All these three would have to be moving in line. In order to do that, from my state's perspective as to how we have been wanting to move forward is, we've taken every 2,000 people, every village with 2,000 population as a unit, and we're coming up with village clinics.
Okay.
And then we're taking up every 30,000 population as a unit, and classifying it as mandal, and where we're coming up with 2 PHCs, primary health centers. These primary health centers would have 4 doctors, 2 of the doctors present in each of the PHC center, and they would be given an ambulance 104, and each of this doctor would be given their designated villages. So 5 villages or 4 villages, depending on the mandal size, to each of these doctors. And these doctors, every alternate day, would hop onto the ambulance and visit the village, and they would become the family doctor for that village. Very soon the doctors, because they've been designated only those 4 villages, so they would start to identify people by names, and they would use this village clinic as a hub. This village clinic primarily would be having an A&M, nursing graduate, mid-level health practitioner, and ASHA workers that we spoke about also reporting there. So that would take care of the preventive part. Now comes the curative part. The curative part would be dealing with the community, with district hospitals, the teaching hospitals, and the area hospitals and the teaching hospitals are going to play a very critical role there. So there we're coming up with every parliament taken as a unit, in order to ensure that there is equitable distribution of teaching hospitals. Because only when you establish teaching hospitals, you have postgraduate students actually coming up there. And only when you have postgraduate students doing their course there, and these teaching hospitals are connected to a hospital, a teaching hospital as well. So teaching college and teaching hospital together would become the tertiary care that we are looking for.
We're going to come back to that issue a little bit later on if we've got time. Catherine, when we're speaking about migration, is it correct to quantify it as a crisis, 1? And 2, what possibilities are there for planning scenarios where even if there is a crisis, there's resilience in healthcare services and there's also a form of adequate care?
Well, yes, it's absolutely a crisis. I mean, the estimates are that 36 million children right now are in migration, sort of crossing borders, and another 20 million are moving inside countries, so IDPs. And that's a horrible problem for children around the world because it's so unstable for them, right? They're moving from one place to another. We don't have good data on whether there is sufficient health care in these migration situations, but we know there's typically not, right? It's very hard. And we encourage countries that are receiving these migrants to incorporate these people into their own health systems, but I can't say that that's happening very much, and so it's very difficult. You could imagine things like routine immunizations, things that matter to children, nutrition, maternal care. All of those things are so disrupted when you're in a situation of migration, as you can imagine. As the minister said, really what you need is good primary health care. That's the single most important thing. And trying to build that up in countries and in situations where migrants are living is really the most important thing. But we're living in a world of very difficult circumstances and very fragile systems that really need to be built up, these healthcare systems, because as we saw with COVID, I mean, even a country like the United States, Western countries are pushed to the brink with something like COVID. So imagine countries that don't have sufficient health care, right, that can't provide that for their people. So we see this as an opportunity now to go in and really try to build up these systems, and that requires good governance, which you're seeing from the minister, but it also requires sustainable resources, which is always the challenging piece.
If we keep using this word resilience when we take